Hello, we're in the fall of 2020. I'm Jacqueline DuPont and I'm a gerontologist, and I'm here to talk today about the new normal during COVID at this time. So we all have been through quite a bit this year, and I want to thank everyone who's been an advocate for our older adults, from facilities, in-home care, adult daycare. All of us have really worked really hard to keep the virus away from our older adults and to hopefully improve our infection control policies and keep our facilities and of course don't forget our employees safe. So it's been a really tough time. However, some positives have come out of it. And you may be thinking, well, what positives? Well, I think the first positive is we're all hyper aware of infection control, of hand washing, glove wearing, hand sanitizer usage, mask usage, floggers, aerosols, all kinds of ways to keep our places where our older adults live healthier and cleaner. We've also engaged more. I think we're all very worried about our older adults. We're checking in, we're making phone calls more. We've tried to attempt these Zoom meetings with their physicians. We've tried to really get physicians to check in on them. And I think I've spoken many times before about the necessity, especially if your older adult has any cognitive impairment or Parkinson's or they're at home more, how important it is to have a doctor come to the home and how Medicare does pay for that. So that is critical. And right now, when restrictions have started to be lifted, it might be a good time for the doctor to go back out and look at them. But what are the positives? So the positives, of course, like I said, are the infection control awareness. And the flu is coming. And I have to tell you, it's here right now, of course, and we can take the flu shot. But, and I'm sure the flu shot is going to be the vaccine's going to be a very good one. It does seem to have good reviews so far. However, we're so aware of this cleanliness and this great environment that needs to occur for every older adult, whether they're living at home or living in a memory care facility or an assisted living. It's critical to look at the cleanliness, to look at the visitor policy, and to make sure everyone's wearing a mask if needed, and to keep that social distancing, of course. But we've thought of these creative ways to keep our older adults engaged during this time, because if they are getting bored and their mental health is really critical. However, we really have paid attention to other areas that we really weren't before. So at this time, our new normal consists of this cleaner environment, and it consists of the physician being proactive. The minute that older adult starts coughing, we are seeing our physicians paying attention, checking temperatures, checking labs, really ordering a lab to come to the home to check their white blood cell count, for example, and checking their urine, how critical that is. And we're catching our urinary tract infections so much faster. And I do think it's because we're paying attention just to everything, appetite, stomach ache, hydration, all these critical issues that we've always wanted to pay attention to, but with COVID, we're hypersensitive now. And I feel it has been a positive in that way. I'm very fortunate that the facilities I had did not get any COVID cases. That doesn't mean I'm any better than anyone else. We've just been very blessed because everyone has worked hard, whether they've had a case or not. It's been a tough time, and I want to congratulate everyone in the whole entire United States who's helped an older adult, whether you're a caregiver, frontline worker, a physician, especially the geriatric physicians who've helped so much, the hospice workers. We have all endured a lot, home health, physical therapy, everyone. So thank you, thank you, thank you. And moving forward, I think we're all going to realize the importance of this new normal and how critical it is for the safety of our older adults in America. Thank you.